One of the tools to help stop the spread of COVID-19 is through contact tracing. ABC4's medical correspondent Saray Chin talks with Intermountain Healthcare to find out how they are redeploying their providers.
Ali Kayas is a speech pathologist, but when the pandemic hit, her workload decreased, especially being immune compromised and suffering her own health issues, including asthma. At the same time, the state health department needed help with contact tracing. Intermountain Healthcare gladly stepped in, and Ali was one of 16 Intermountain caregivers redeployed from their job and stepped in.
Even though I wasn't seeing my patients, going into the hospitals the same way some of my other coworkers were, I could still be helping my community. I could be lending my medical knowledge to those who needed me, my problem-solving skills, my communication skills.
Roughly 1,200 contact tracers are working with the state and local health departments.
My name is Alexandra Kayas, and I'm calling on behalf of the Utah Department of Health.
Their role is to interview people who have either been tested positive with COVID-19 or have been in close contact with someone who has tested positive. Contact tracers then recommend and educate people on quarantining.
The most important measure to stop spreading COVID is to not get it. And so really you look at contact tracing as sort of a secondary prevention or a second line of defense, right? So someone's gotten the infection and now we want to find out who they've been in contact with. So we have to have really detailed interviews, very comprehensive questions that are asked of these cases.
Intermountain Healthcare infectious disease expert Dr. Todd Vento says contact tracers are more important than ever now that COVID-19 cases are on the rise in Utah.
Our cases are increasing. We are showing that we have community spread of this virus throughout the state, not just big counties. Throughout the state, the numbers are increasing. And what the contact tracing folks have seen is that, say, 2 months ago, they may have identified a case and they had a few contacts. And now, with the increased transmission in the community, the increased movement of individuals who are no longer in, say, essentially a shutdown mode, there's more interaction, more spread. And so our contact tracers are having to trace up to 15, 20 contacts of individual cases.
Those numbers could be much smaller, Dr. Vento says, if we continue to wear our masks, adhere to social distancing, and have good hygiene. Contact tracing is one of the most important tools to help stop or slow the spread of the virus. The Utah Health Department identifies people who might be at risk of infection if you've been within 6 feet and spent 10 minutes with someone who has the virus. But it takes people like Ali to find out more.
Can sound really cut and dry. Okay, you ask these questions and then you give this information, but each person is really different and their situation is dynamic, and they're not just someone who sits at home. They have a job, they have friends, they have a family.
Tell me what you did. What were you doing? Oh, we were in the same car for 5 minutes and the person was coughing incessantly, repeatedly. That's a little different than saying I'm 6 feet in 10 minutes versus I'm in a closed situation where someone's coughing all over me, and they may at that point say, you know, that's a high risk contact. Let's quarantine you to see if you develop symptoms.
Ali wants people to know if you get a call from her, she appreciates the time you're taking to be interviewed, and the information you give could save lives and help us better understand the virus.
Personally, as someone who does have some of my own health issues, being able to be a part of the solution for slowing the spread of COVID, finding out more about how to stop it and protect people, that means extra to me, being in an at-risk population, because the sooner that we find that out, the sooner that everyone can get back to their lives and I can get back to treating my patients the way I did before.
Saray Chin, ABC4 News.